welcome to this episode of the Dry Eye and Ocular Surface Disease section of the Clinical Podcast Series, brought to you by the American Academy of Optometry Foundation. Today's episode is caffeine's protective role in dry eye disease and meibomian gland dysfunction, insights from clinical and experimental models. My name is Kaleb Abbott. I'm an optometrist and assistant professor at the University of Colorado School of Medicine, and I'm joined by Dr. Lisa Hornick, who is the Director of Dry Eye Services at Stanford Ranch Optometry near Sacramento, California. We are so excited to have her join the podcast as an expert in all things dry eye.
So happy to be here. Thank you.
So when it comes to dry eye, there's a lot of myths out there. For instance, the myth that you can simply drink more water and drinking more water is going to fix all of your dry eye problems. And even if you Google that, you find that's one of the top recommendations that's out there. But there's really no data that actually really shows us this. Do you feel like there's any myths regarding dry eye and caffeine?
Yes, absolutely. And the drinking water point is so interesting because you're right. We always say, if we look on Google that, if you drink more water, you're going to have, solve all your problems. And while I will say it is important for overall body health that we're hydrated, of course, we don't want to be dehydrated, but there is no specific study how that translates to dry eye disease. So there's nothing that says, for example, you need to drink X number of glasses of water per day to help your dry eye disease. So that's definitely a myth out there, which I also think is really interesting. And how that relates to caffeine, I think we have this idea in our head that caffeine is probably negatively affecting our dry eyes because it is a diuretic and it's dehydrating us. But we're going to find out some maybe different information here.
Yes, we will. Yeah, caffeine seems to have a bad reputation out there, but we do know it is beneficial in certain conditions, like neurological conditions such as Alzheimer's disease. So prior to this study, what was your assumptions regarding caffeine? Do you think it was beneficial, harmful, or neutral in the context of dry eye?
Yeah, so actually in the very beginning, I thought it was probably harmful for dry eye, just based on that idea that it was a diuretic, right? And then when I read the TFAS lifestyle report in 2023, they talked about caffeine quite a bit, actually. And I thought it was, again, so fascinating. I was pleasantly surprised because I'm a huge caffeine drinker. I love my lattes.
Me too.
There's a lot of us out there. We love our caffeine, right? And so I think we all breathed a collective sigh of relief when we found out that caffeine actually can be beneficial for dry eye disease. And the way that they explain it in the TFAS lifestyle report is that it may be beneficial due to increased lacrimal gland secretions, the antioxidant benefits of the caffeine bean, and then possibly an induced analgesic effect.
Very interesting.
Yeah.
So this study is looking at caffeine and dry eye. It's a little bit complicated of a study because there's really three different arms to it. You've got a clinical side, you've got an in vitro rat side, and then you actually have an in vivo part as well. Can you explain kind of roughly how this study was conducted?
Yeah, absolutely. And I love that they did that. I love that they did the three different arms of the study. And I think it's really important that we look at things that way. And especially with our clinical study, the participants, they completed a daily caffeine intake questionnaire, and then they underwent different ophthalmic examinations. For the caffeine group, they had a daily caffeine intake of at least 200 milligrams. So that's equivalent to about two small cups of coffee or a large cup of coffee. And the other control group had no caffeine consumption whatsoever. The participants in the control and the caffeine groups were compared, and they looked at the ocular surface and then also some tear inflammatory cytokines. For the in vitro study, they had rat meibomian gland epithelial cells and human corneal epithelial cells, which were pre-treated with or without caffeine. And then for the in vivo study, they had apolipoprotein E knockout mice that were given either a caffeine diet or a no caffeine diet, and they compared their meibomian glands and corneal tissue.
Very interesting. And what did this study find?
So for the clinical part, the participants in the caffeine group showed a significantly healthier ocular surface, lower tear inflammatory cytokines, and a reduced prevalence of dry eye compared to the control group. So really good news there. In the in vitro mouse study, the caffeine pretreatment reduced inflammatory responses, apoptosis, and differentiation in the lipopolysaccharide-induced rat meibomian gland epithelial cells. And the caffeine also suppressed inflammatory responses and apoptosis in the human corneal epithelial cells. So again, more good news. Yeah. And then in the in vivo mouse study, that showed that the ApoE knockout mice with a caffeine diet had more normal morphology of meibomian glands and corneas compared to those without the caffeine diet, along with a reduced inflammatory response, cell apoptosis, and ductal keratinization. So that was a lot of information right there.
Mm-hmm. Yeah, if you could kind of summarize how it helped humans.
Yeah, absolutely. So for the summary, and here's your key takeaways, is that actually in all three arms of the study, in the human participants, the in vitro and the in vivo mouse data, we had decrease of inflammation, less dry eye symptoms, less corneal staining, less redness, and better meibomian gland structure. So just healthier overall.
Yeah, that's amazing. So it actually seems to have made quite a difference, in all the different arms of the study. No matter how you sliced or diced it, caffeine seemed to improve dry eye. And you mentioned a little bit of the reasons as to why caffeine could be beneficial, but could you highlight that maybe one more time?
Absolutely. Yeah. So caffeine has been shown to exhibit antioxidant effects, anti-aging, anti-obesity, anti-inflammatory, and oxidative stress reducing effects. So therefore, it does make sense that would help with our dry eye disease patients. It can help systemically as far as neurological, lung, and liver diseases. And then again, for the eyes, it's been demonstrated to protect even the retina. And now possibly, treatment for dry eye disease and meibomian gland dysfunction.
That is good news for you and I and a lot of our listeners. So any final thoughts for those listening to this podcast?
Yeah, I think this is really exciting. Finally, some good news. I think with dry eye disease, we don't have to give up our lattes anytime soon. I'm just really excited about this potential treatment and the potential protective effect that caffeine does have for dry eye disease and meibomian gland dysfunction. I do want to note, though, it is important to remember that these human participants only consume 200 milligrams of caffeine or 1 large cup of coffee a day. So we can tend to overdo it sometimes, right, with our caffeine intake, which can negatively affect our sleep. Having good quality sleep is critical for a healthy ocular surface. So you can have your latte, just make sure you don't overdo it.
I love that. That is excellent point that you made. All right. Well, special thanks to Dr. Lisa Hornick for joining us today on the Clinical Podcast Series, and we will see you at the next episode.
Thanks so much.